A very warm welcome to another exciting edition of your favorite program, Health Affair on AIT. On the program, we focus on critical public health challenges, issues of women and children with a view to finding lasting solutions. My name is Oshuomowa Daniels, your host. Burns from fire-related disasters, hot water, other accidents in workplace or home, according to some health experts, account for 4.8% of trauma deaths in Nigeria and 6.7% of surgical-related deaths. The first aid for burns, how to prevent sustaining burns in an accident scene, is the thrust of our discussion today on the program. Please don't go away. We'll set the ball rolling right after the news segment.
The United States Agency for International Development, USAID, on February 24, 2021, launched the new activity designed to empower as many as 2 million young Nigerians with life skills and resources to realize their future. The 5-year, $50 million youth-powered ecosystem to advance urban adolescent health projects will help teens access reproductive health services within a holistic context of youth empowerment. Adolescent Health will build a network of youth hubs to provide age-appropriate access to a host of services and teach life skills, leadership, and work readiness. The hubs will provide safe spaces for adolescents to receive information and support to uptake reproductive health and improved behaviors through regular interventions, club meetings, youth-led events, groups, camps, and other community outreach and events. The Oxford AstraZeneca COVID-19 vaccine has finally arrived Nigeria. A cheering news indeed, but it's however not an invitation to get careless. According to some WHO officials who have appealed to Nigerians to keep observing the COVID-19 preventive guidelines despite the availability of vaccines. Speaking during a risk communication training for health reporters in Lagos, the officials noted that prevention remains the best option to break the chain of community spread of COVID-19 virus and other diseases.
Before the vaccine came, they were already almost out, of the epidemic. So what is this telling us? The solution ultimately is not going to be vaccines. Ultimately, the solution is going to be how we break the chain of transmission. The virus is moving from one person to another, from one person. So once you create space between that last person and the next one, you break it, and it ends there.
Issues concerning safety of journalists were also brought to the fore.
Well, in terms of quality, the quality of delivery and the package, top notch. But I observed that all the training that have so far been organized for journalists and all did not speak to the safety of journalists. It's restricted to how to report, communicate with the community. Driving home the lectures and all, putting it across to the community, but none of them is speaking to the safety of that journalist who are the most vulnerable.
On our priority list for risk communication, you are number one. And because you're number one, it means we are thinking of you. And when vaccination comes, there will be a program that puts into consideration so that eventually when we have to vaccinate, we know how we are prioritizing.
Pharmaceutical Society of Nigeria has confirmed the safety of the Oxford AstraZeneca COVID-19 vaccine for use in Nigeria. The approval is coming a few days after the National Agency for Food and Drug Administration and Control, NAFDAC, approved it for use.
NAFDAC, they've done their due diligence and they have stood behind this vaccine to say that it is safe. So please don't say no to these vaccines. Take them.
For Nigeria to be better positioned for vaccines production, members of the Pharmaceutical Society of Nigeria also called for the passage of the Pharmacy Bill.
Nigeria cannot produce vaccine without passing the pharmacy bill that is gathering dust at the National Assembly. So the media, you don't want another pandemic to catch you unawares and we start running around and propounding theories of who want to depopulate Africa.
This COVID is enough lesson for us to start doing the right thing. What kind of pharmacy do we want in the country?
Injuries associated with burns continue to be a major source of mortality and morbidity in low-income countries of the world, including Nigeria. These injuries occur in Nigeria mostly from fire outbreaks, gas explosion, occupational accident, and some minor accidents at home. Irrespective of the cause of this category of injuries, they remain quite expensive to manage. Do you know that it costs not less than 1 million naira to manage severe burn injuries in 1 week and 3 million within a month? Yes, it is as serious as that. But the good news is that burn injuries are preventable. I spoke with a surgeon, Dr. Folake Olushola Abikoye, on this topical issue. Dr. Folake is a fellow of the West African College of Surgeons and head Burns and Plastic Surgery Department at the National Orthopedic Hospital, Igbobi, Lagos.
Burns is a trauma that can be sustained to skin or even deeper structures from various agents. Some of the burn injury may give a kind of what we call coagulative necrosis or liquefactive. I won't bore us with that. But more importantly, there are various agents that can cause the burn. This includes flame burns. It includes liquids, scald, like children pulling water or running into hot water. It could be from electric shock. It could be from lightning, flash burns. It could be from chemicals. Acids, alkali chemicals can cause burns. Even friction, when people have accidents and they are dragged, or they may sustain some kind of friction burns. And in the extremes of climes, like where they have extremes of very cold temperature, there could be burn from cold, the frost bites. Those are various kinds of burns. Now, burn injury, there are different degrees of burns. The burn injury can either be partial thickness burns, which means it doesn't involve the full thickness of the skin, or it can be full thickness burns, which includes the epidermis and dermis, the whole thing, and it can go even into the subcutaneous tissue. Now, to manage burns, it depends on the part of the body that the burn is involved and the degree of burns that happens. I will just seize this opportunity to mention that we do a lot of burn awareness, and one of the things we say is that if there's a burn injury, it's water, water, water. Instead of contaminating it with egg, flour, urine, and all sorts of things, engine oil which people apply. All those ones, if for example the burn wound was superficial, it could convert it into full thickness burns. Now, the current trend of managing burns, which we have to relate to surgery, number one is that, of course, burns, you have the ABCD of burns, but as per surgery, which you are interested in, if burns is full thickness burns, we know that it's fully cooked. It is best, especially if it's best to excise the part of burn, and if the patient has another site on the body where you can harvest skin from, you can harvest split thickness skin from another site, excise that burn and cover it with that skin. That skin that you harvest, there are some equipment that can be used to expand the skin, like run it through a machine to make it like a mesh, so that you take small quantity of skin and you can cover a large area of injury. That is for the acute. So for acute burns, you may need to either manage conservatively, or you may need to excise the burn wound and graft with skin graft. Sometimes some parts of the body may require flaps. Occasionally, if you have or if there are electric burns and the area is fully cooked, it's fully charred, some may require amputations of the extremity. Those are also some sort of surgery. Now, If burn injuries are not well managed initially and followed up for a period of time, when the burn wound heals, maybe instead of resurfacing with skin grafts, you continue to dress for many months to years, patient may come up with contractures, deformities. So you may have deformities of the hand, which are extensor or flexor contractures. They may not be able to elbows, their axilla, their face, neck, different parts of the body. So managing burns, some of the things is the precautions you take. You nurse them in anti-deformity. But if you don't, and the burn is not well managed, they have deformities.
Can you give us an estimate of number of patients you get in a year?
In a year, well, I can't give you the exact, I can just give you a rough number. In a month, for both the burn injury and sequelae, we may get about 20 to 30 patients in a month. The reason for this is that burns is a very expensive injury. When patients come, in the kind of government we have, there are many patients pay from their pocket. They are fee-paying patients. So quite a number are not able to afford. And the truth is that with the burn injury itself, many a times a structure is burned down. They've lost all their property. So they don't have so much. So they need funds to be able to take care of them. Many of them don't have funds. So they present, we start, but some run away due to lack of funds, and they just resort to either self-medication at home, or but they just look for other options. I mean, some just discharge once they hear that, oh, it involves money.
Can't one care be integrated into the NHIS to make it easier for people to pay out of pocket?
I think it may, but that would be very difficult. Bonds is a very expensive thing. Rather, I think it would be nice for us to have non-governmental organizations who can put it as a corporate social responsibility. We have many of the oil companies that deal with inflammable materials, and as part of their corporate social responsibility, they can put up structures dedicated, purpose-built burn units to actually and furnish and support. Because I've been to some centers, even in South Africa, they are supported by some organizations like Johnson & Johnson. They build and they sustain, they actually give all the supplies that are being needed, such that the unit is not lacking. You have adequate materials and adequate instrumentations to be able to nurse these patients are right. For some burn patients, if you are managing optimally, within a week, they may be spending, sometimes if you get in even the special dressing products, they may be spending $1 million or $2 million within a week, depending on the kind of agents that you use for them. For some, even if you don't go to the high end, for a burn patient to be nursed in about a month, the patient may have spent about a month to two, may spend $2 to $3 million. So burns is very expensive. I am not sure if NHIS can appropriately provide adequate amount of things that they need. For burns, when you have them, especially extensive, moderate to major burns, you need to run the investigations serially, their dressing changes, the materials, they need surgical procedures. There are so many things, and it's a continuum. It's not just, something little and stop. You have to keep, reviewing very frequently and correcting and optimizing the patients so that the patients can move from a catabolic state into an anabolic state. That means instead of losing more protein, can tilt to the better side of healing.
Now, if a patient is to spend up to $3 million in a month, how long does it take for that burns to heal?
It's varied. Some we may offer surgeries, excision, and grafting. For some of the one I mentioned, like the cost, there are some specialized dressings that if some patients can afford, they import there some silver nanocrystalline, the current trend dressings that are being used. They are quite expensive. For you to do one wrap, although the dressing can stay for quite some days, it runs into, for an adult, it may run to almost 1 million for an adult. It may be less. But if you offer surgery, the other additionals that may be required, the dressing material, I mean, it takes a lot. You have to try to control the atmosphere to try to prevent infection, setting in.
So for those who cannot afford it, what can we do? How can society help them?
The ways is we can have non-governmental organizations come up with a post dedicated, being run to support the care of burn injury in Nigeria. It will go a long way in helping in the care of burns.
How do we talk about the role of plastic surgery in burns management?
In some places, it's not only the plastic surgeons that manage burns. If you are trained as a burn surgeon, some general surgeons are trained as burn surgeons. You can also manage the burn. But the more important thing for burns is when a burn injury happens, pre-hospital care, appropriate cleaning and covering of the wound, and cleaning of the wound, cooling of the burn wound with water, try and prevent contamination, moving the patient to the appropriate center for appropriate care. That is pre-hospital care, hospital care. That's proper management of burns, appropriate cleaning and covering to prevent infection. If the burns is deep dermal or full thickness, instead of keeping the patient for a prolonged period to continue dressing, early excision, the current trend is early excision of these burn wounds and resurfacing with skin grafts, such that the patient can recover quickly. We always want to ask the patients how this burn injury happened. It's a very important, the history. And we need to health educate the people involved, either the parents or the patients, why, we find out how the burn injury, and then we need to analyze, is it a preventable burn or it's not? And many a times, I've come to realize that many people take so many things for granted, and we need to keep explaining and health educating. So I'm managing burns, I health educate you, and I manage that burn as a rule. So we ask, it's not that we want to crucify you or anything, we are not a judge, but we tell you that this thing could have been prevented. These are steps. You should avert it next time. For example, the children. Some people, as at a few weeks back, I had a child, maybe somebody carrying hot water upstairs in a container, and the child is running down and, runs into the hot water, and the child sustained burns. Water for bath. We always say, for bathing, if you need hot water to have your bath, and you are boiling it elsewhere, the hot water must always meet cold water before you move it. What do I mean by that? You should have some ordinary water in a bucket. Yes, you want to use warm water to have your bath. Have ordinary water and then pour that boiling water into that ordinary water so that the temperature is not at 100 degrees or higher when somebody runs into you. For fire explosion, especially the gas, I need to comment that quite a number of people put cylinders inside the house for the fear of people stealing the cylinders. However, the safest position to put the gas cylinders is outside, so that if the gas is going to leak, it leaks to the exterior rather than filling the room. Some people can't smell while some can. Some are naive, or maybe they send their help or something, and they smell, but they don't know that if gas has engulfed the room, if you light a match, it will cause a burn. So you need to also educate that if you smell gas, you think that there's a gas leak, open all windows around the kitchen, open so that the air, the gas can go out as much as possible. And do not strike a match. You just leave everything open, no cooking, don't be in a hurry. It is better you remain hungry than you try to, make one little food that can mess you up completely. So just air the room before and give some time. Maybe you may even give up to 30 minutes to 1 hour to be sure that the smell has gone before. Now, if one is involved in a fire, and as you run, the oxygen continues to fuel the fire as you run. So to break that cycle of the oxygen fueling the fire, you stop, you drop and roll. So that will, like stop the oxygen that is fueling the fire to quench the fire.
What's the first aid to take? The first aid for burns?
The first aid for burns is once there is a running, open the tap, running water to cool the area for about 5 to 10 minutes. Just keep cooling it immediately. An example is if you say, oh, there's fire, you are still looking for egg to pour, that hot temperature remains, and then it will be causing deeper burn injury. Unlike immediately there's burn, you put underwater and it starts cooling the temperature. That heat, instead of the contact period being very hot, being for a prolonged period, it will reduce drastically with the cooling of that part.
Some say you look for GV, some say you look for honey. Tell us more. Just a quick first
All
aid.
you need to do is keep cooling it. Just keep cooling it. And as soon as possible, cover with a clean coat and present in the hospital. People try to use so many things, like you said. Honey, if it's good honey, it's not, we use honey even to treat burns, but first of all, cool the temperature so that that hot substance does not continue to cause further damage.
We appreciate you.
Thank you very
Thank
much.
you.
Thank you.
Now, let's take you to our nutrition segment. The focus today is on tomatoes.
Tomato is an edible berry plant that originated in Western South America and Central America. The tomato is a nutrient-dense superfood that offers a lot of benefits to the body system. The nutritional content of tomatoes supports healthy skin, weight loss, and maintenance of the heart. Tomatoes, according to some scientific reports, are now the fourth most popular fresh market vegetable after potatoes, lettuce, and onions. Including tomatoes in your diet can help protect against cancer. It helps to maintain healthy blood pressure and reduces blood glucose in people with diabetes. Eating tomatoes can also help protect the eyes against light-induced damage. Tomatoes can be consumed by adding them to sandwiches, wraps, in sauces, or alternatively cooked to boost the availability of key nutrients. Tomatoes are a great source of folate, which is very essential before and during pregnancy. 1 cup of chopped or sliced raw tomatoes contains 32 calories, 170.14 grams of water, 1.58 grams of protein, 2.2 grams of fiber, 5.8 grams of carbohydrate. Tomatoes also contain several vitamins and minerals.
On Health Affair, we'll give you a holistic approach to health education and care. So, come with me to our clinic for tips on healthy living.
Did you know that excessive use of medicine damages the liver and the kidney? There are lots of fake drugs in the market. Please buy your medicines from reputable pharmacy shops. Please drink plenty of water, minimum of at least 2 liters of water in a day. Brush your teeth twice daily with toothbrush and toothpaste. Exercise regularly to keep fit. And please, very important, always wash your hands with soap and water.
Participate on our perception segment. Please call the numbers showing on your screen.
Lab following you with face mask. They are ready to bring the cost down. 15 naira, you buy it. Listen, and somebody is going to give it to you at 1,000 naira. Somebody is making 50,000 naira per pack of face mask that sells for 3,500. That's not supposed to be.
Methylated spirit refers to alcohol for general use that has been made unfit for drinking by the addition of 10% methanol and sometimes violet dye. Methylated spirit is commonly used in hospitals to sterilize medical equipment, to clean wounds, and lots more. It is also an effective solvent in paints.
This is where we draw the curtain on the show today. Thanks for spending your time with us. Please let's do it again same time next week. My name is Oshuomowa Daniels. Your health is your wealth. Please pay attention to it.